the state offered a public option. It was an HMO. It was designed to cover the uninsured and to cover children. As I said, it was done under a waiver. They changed the match with all the money because of this. And as with many programs such as this, cost exploded and it went beyond the state's wildest expectations on what it was going to cost. And Tennesseans will tell you that comprehensive, all-inclusive health care in that manner is not affordable, especially when you've got government's resources that are fixed on how they would cover that. The state spending accelerated from $2.5 billion in '95 to $8 billion. This is state spending. State spending went from $2.5 billion to $8 billion in '04, and that is on TennCare alone. The TennCare program began to consume every dollar of new revenue that was generated in the state of Tennessee. So it is clear evidence that government-managed health care programs like this allow for serious mismanagement, for cost overruns, and for inadequate service. One of the things that I brought along today was a copy of an article that was in Associated Press. It was by Carla Johnson, May 28th, 2009. Congress can learn from Massachusetts, Tennessee health plans. And it quotes our now governor, Governor Bredesen. And I will read to you from the article. A state program built around Medicaid called TennCare, and I'm quoting the governor at this point. Quote, got totally out of control. It was growing at 15% a year. Tennessee had the most expensive Medicaid program in the country, end quote, Bredesen said. And quote again, our experience with trying to do universal coverage ended up being a disaster, end quote. When Bredesen took office in 2003, he inherited soaring state health care spending. In 2005, he cut 170,000 adults from TennCare. He reduced benefits for thousands more. So there are lessons learned that are there in what does and does not work. Now, part of the cost explosion in TennCare came because 55% of those added to TennCare came from the uninsured population. The others were individuals that had private insurance, and guess what? They decided to opt in for the free option, get onto the TennCare program for the free option with unlimited benefits because it covered everything, and you had access to a wide menu of health care services. So they would drop their private insurance. We would hear stories. I was in the state Senate, and we would hear stories from individuals that would talk about people coming to their office and trying to buy an uninsurable letter so that they could get onto the TennCare program. So Tennessee has been this laboratory for universal care. It is a lesson that members of Congress need to go back and give a good close study of what is going to happen when you look at a public option in competition with private options.